Hi friends, so today we'll be having a quiz session on the Cavernous Sinus. I've already done a tutorial session on the Cavernous Sinus, so if you haven't watched that video, kindly do so. So let's begin with our question and answer session. So the first question, which of the following nerve is not found in the lateral wall of the cavernous sinus? Which of the following nerve is not found in the lateral wall of the cavernous sinus? So A is oculomotor, B is maxillary division of trigeminal, C is trochlear nerve, D is ophthalmic division of trigeminal, D is mandibular division of trigeminal. So which artery is not found in the lateral wall of the cavernous sinus? So let's look at the answer. So the answer is the mandibular division of the trigeminal nerve. So we said that there's a trigeminal ganglion which has three parts. We have the ophthalmic division, we have the maxillary division, and we have the mandibular division. Now this is the lateral wall, this is the cavernous sinus. This is the cavernous sinus. So you can see we said that the cavernous sinus is formed by the splitting of the two layers of the dura mater. That's the meningeal layer and the periosteal layer, or the endosteal layer. So this where my cursor is going upwards, this is the endosteal layer, and this is the meningeal layer. So follow my cursor, this is the meningeal layer. So this space is the cavernous sinus. Now you can see the structures here in color yellow. So where my cursor is pointing is the oculomotor nerve, the third cranial nerve. Just inferior to it is the trochlear nerve. Okay, and this structure where my cursor is the ophthalmic division of trigeminal, and this is the maxillary division of trigeminal. So these are the structures found within the lateral wall: oculomotor, trochlear, ophthalmic division, and then maxillary division. So mandibular division of the trigeminal is not part of the lateral wall of the cavernous sinus. It goes through the foramen ovale. Right. So question 2. The abducent nerve lies dashed to the internal carotid artery. The abducent nerve lies dashed to the internal carotid artery. Is it medial to the internal carotid artery? Is it lateral? Is it inferior? Is it inferior? Okay, so let's look at the answer. So within the cavernous sinus, there's a very big, large artery here. Here where my cursor is, this is the internal carotid artery. Around the internal carotid artery, we have sympathetic plexus, venous plexus. Now beneath this nerve, this is the abducent nerve. You can see that the abducent nerve is inferior to the internal carotid artery. Okay, so the abducent nerve is inferior to the internal carotid artery. Okay. The cavernous sinus, this is question 3. The cavernous sinus extends anteriorly at the cavernous sinus extends anteriorly at the. So this, let's review the osteology of the skull base. Now this blue structure here, this is where the cavernous sinus is. We said that the cavernous sinus extends anteriorly at the superior orbital fissure. Superior orbital fissure. Okay. So the answer to the question is superior orbital fissure. We also said that there's this important anatomical landmark, okay, when performing surgeries around the cavernous sinus. This structure where my cursor is called the anterior clinoid process, which has two roots: the posterior root, which is usually referred to as the optic tract, which separates the optic canal from the superior orbital fissure, and the anterior root, which forms the roof of the superior orbital fissure. Okay, so this is the cavernous sinus. It extends anteriorly from the superior orbital fissure. So move to the next question. Question 4. The cavernous sinus extends posteriorly at the cavernous sinus extends posteriorly at the. So still reviewing the osteology. So anteriorly is the superior orbital fissure. Then it extends posteriorly. Now just follow my cursor. This is the petrous part of the temporal bone. This is the petrous part of the temporal bone. This is the petrous part of the temporal bone. Now just here is referred to that as the apex. This is the apex of the petrous part of the temporal bone. So we call it petrous apex. So the cavernous sinus extends anteriorly from the superior orbital fissure and extends posteriorly at the petrous apex. The fifth question: venous blood that flows to the cavernous sinus is from the following except. Venous blood that flows to the cavernous sinus is from the following except. A, we have the superior ophthalmic veins, we have the inferior ophthalmic veins, we have the central retinal vein, the sphenoparietal sinus, and E, internal jugular vein. So let's look at the answer. So this is a schematic diagram which shows the tributaries of the cavernous sinus. So here is the anterior end. This is the anterior end of the cavernous. This is the cavernous sinus. This is the anterior end. This is the posterior end. So the question is asking us to indicate. So the anterior end, which vessel is not part of the anterior, and the anterior end, we have the ophthalmic vein, we have the central retinal vein, we have the sphenoparietal sinus. So the only vein that is not at the anterior end is the internal jugular vein. Question 6. The communication between the left and the right cavernous sinus is made by. So still looking at this diagram, you can see this is the cavernous sinus. This is the right cavernous sinus, this is the left cavernous sinus. You can see this three interconnection between the two cavernous sinus. These are called the intercavernous sinuses. It connects the two cavernous sinus together. Okay, so we have the anterior and then the posterior intercavernous sinus. Which tributaries at the anterior end drains into the cavernous sinus? Which tributaries at the anterior end drains into the cavernous sinus? So the answer is these three veins. The central, so we said this is the anterior end. The central retinal vein drains into the cavernous sinus. The ophthalmic vein, so we have the superior and the inferior ophthalmic veins. They drain into the cavernous sinus. And then we have the sphenoparietal sinus draining into the cavernous sinus. Question 8. The anterior facial vein is directly connected to the cavernous sinus through which veins? Okay, the anterior facial vein is directly connected to the cavernous sinus through which veins? So looking at this diagram, see that the anterior facial vein, okay, has connections with the cavernous sinus either directly or indirectly. Now the direct connections of the anterior facial vein to the cavernous sinus. So first of all, let me show you where the anterior facial vein is. So just follow my cursor, coming down. This is the anterior facial vein, all the way down. This is the anterior facial vein. Okay, now you can see direct connection. This is the cavernous sinus. You can see direct connection from this vessel here directly into the cavernous sinus, and then also this vessel going directly into the cavernous sinus. Okay, now these are the ophthalmic veins where my cursor is. The ophthalmic veins. This is the superior ophthalmic vein, this is the inferior ophthalmic vein. So the anterior facial vein is connected to the cavernous sinus directly by the ophthalmic veins. What is the medial relations of the cavernous sinus? Okay, so when we look at the cavernous sinus medially, let's just draw an imaginary line between the pituitary. So medially, this is the cavernous sinus. So the medial border will be maybe one half of the pituitary and the sphenoid air sinus. Pituitary gland and then the sphenoid air sinus. So the last question, describe the drainage system of the cavernous sinus. So there are two main drainage systems. Okay, the cavernous sinus actually drains posteriorly. So we have the superior petrosal sinus draining into the transverse sinus, and then we have the inferior petrosal sinus draining into the internal jugular vein. Okay, so this is the superior petrosal sinus draining into the transverse sinus. It is the transverse sinus. So superior petrosal sinus. So this is the superior petrosal sinus draining into the transverse sinus. So where my cursor is the transverse sinus, and then you have the inferior petrosal sinus draining into the internal jugular vein. So just as a form of recap, just to recapitulate, we've looked at the cavernous sinus we looked at what the cavernous sinus is. We looked at the location of the cavernous sinus. We said that the cavernous sinus is found adjacent to the body of the sphenoid and also to the sella turcica. We looked at the certain important structures that goes through the cavernous sinus. We looked at the lateral wall of the cavernous sinus, and we looked at the cranial nerves that goes through the lateral wall of the cavernous sinus. We looked at the oculomotor nerve, the trochlear nerve, the ophthalmic division of trigeminal, and then the maxillary division of trigeminal. We said that the mandibular division does not form part of the lateral wall. The mandibular division goes through the foramen ovale. And then we also looked at some of the important structures that are found medially, okay, to these nerves. We looked at the internal carotid artery, and then if you laterally, we looked at the abducent nerve. Thank you very much for your time, and I'll see you in the next video. Kindly like, share, and subscribe to my YouTube channel. Thank you.